Hey there students, welcome to Crazy Nurse RN channel, where learning becomes a tradition. Today, we'll begin Block 2 with our quick PNLE and NCLEX-RN question and answer review session. This review video was made by Crazy Nurse RN to help student nurses, unlicensed nurses, and professional registered nurses who want to prepare for exams and gain insights about nursing topics. If you think this helps you, please subscribe, like, and share this video. Let's now begin Block 2. The typical pneumonia of AIDS is caused by pneumocystic carinii. What type of oral or esophageal infections do AIDS patients get? Candida. What is the number one cancer that AIDS patients get? Kaposi sarcoma. Kaposi sarcoma is a cancer of the blank. Skin. True or false? AIDS patients get lymphomas. True. What lab findings are present in AIDS? Decreased red blood cells, white blood cells, and platelets. If the AIDS patient has leukopenia, they will be on blank. Protective or reverse isolation. Define leukopenia. Decrease in white blood cells indicated viral infection. Without leukopenia, the AIDS patient will be on blank precautions. Standard precautions or blood and body fluid precautions. When the AIDS patient has a low platelet count, what is indicated? Bleeding precautions. No intramuscular injections. No rectal temperatures, and other bleeding precautions. Does AIDS require a single room? Yes, if WBC counts are low. When do you need a gown with AIDS? If you are going to get contaminated with secretions. When do you need a mask with AIDS? Not usually unless they have an infection caused by an airborne bug. When do you need goggles with AIDS? During suctioning. During starting central line. And arterial procedures. If an AIDS patient's blood contaminates a countertop, with what do you clean? 1:10 solution of bleach and water. Are all articles used by AIDS patients double bagged? No, only those contaminated with secretions. Can AIDS patients leave the floor? Yes, unless WBCs are very low. Is dietary protein limited in acute glomerulonephritis or AGN? Not usually. However, if there is severe azotemia, then it may be restricted. Define azotemia. Nitrogenous waste in the blood. Increased creatinine BUN. What is the best indicator of renal function? The serum creatinine. Do people recover from AGN? Yes, the vast majority of all clients recover completely from it. How can AGN be prevented? By having all sore throats cultured from strep and treating any strep infections. What is the most important intervention in treating AGN? Bed rest. They can walk if hematuria, edema, and hypertension are gone. What is the most common dietary restriction for AGN? Moderate sodium restriction. Fluid restriction is number 2 if edema is severe. What are the urinalysis findings on AGN? Hematuria. Proteinuria +3 to +4. Specific gravity up. How long after strep infection does AGN develop? 2 to 3 weeks after initial infection. How do you assess fluid excess in the child with AGN? Daily weight. What organism causes acute glomerular nephritis? Group A beta hemolytic strep. What happens to the kidney in AGN? It becomes clogged with antigen-antibody complexes, which then cause inflammation and loss of function. How often are vital sign measurements taken in AGN? Every 4 hours with blood pressure. Will the client have hypo or hypertension with AGN, and why? Hypertension because of fluid retention. What are the first signs of AGN? Puffiness of face and dark urine. What are the 3 adult stages of development called? Early, middle, and late adulthood. What is the age range for early adulthood? 19 years old to 35 years old. What is the age range for middle adulthood? 35 to 64 years old. What is the age range for late adulthood? 64 until death. What is the developmental task for early adulthood? Intimacy versus isolation. What is the developmental task for middle adulthood? Generativity versus stagnation. Intimacy versus isolation. Erickson's stage in which individuals form deeply personal relationships, marry, begins families. Generativity versus stagnation. Erickson's stage of social development in which middle-aged people begin to devote themselves more to fulfilling one's potential and doing public service. What is the developmental test for later adulthood? Ego integrity versus despair. Ego integrity versus despair. People in late adulthood either achieve a sense of integrity of the self by accepting the lives they have lived, or yield to despair that their lives cannot be relived. Time is too short to start another life, though I wish I could, is an example of blank. Despair. If I had to do it over again, I'd live my life just about the same, is an example of blank. Ego integrity. The result of the positive resolution of the final life crisis. Viewed as the key to harmonious personality development, the individual views the whole life with satisfaction and contentment. What does AKA mean? Above the knee amputation. What does BKA means? Below the knee amputation. If the patient had an AKA done, they should lie blank several times per day. Prone to prevent flexion contracture. The number one contracture problem in AKA is blank of the blank. Flexion of the hip. What will prevent hip flexion contracture after AKA? Lying prone for several times a day. What is the number one contracture problem after BKA? Flexion of the knee. This ends our review presentation. Good job! You're now done with Block 2. More to go, and just keep on reaching your goals. This has been Crazy Nurse RN YouTube channel, and see you on our next review session. Please subscribe, like, and share this video to your friends, classmates, and colleagues. See you next time!